so much. I'll try to be fast in order to not make you sleep. I have no disclosure about this topic. There is no escaping from the most typed word last year. That was metaverse. This is a really nice and funny argument. And we are talking about artificial intelligence that is able to combine what we see and what we could see and maybe mix it with augmented reality, virtual reality, Web 3.0, and robotics. If you want to have a little of time and type on PubMed metaverse, you will find 500 results. If you type augmented reality, almost 6,000 results. But if you type virtual reality, we have a lot of literature regarding this topic. So what does it mean, virtual reality? Maybe two here don't know what does it mean, but I would say again, is a fully immersive virtual environment, a kind of parallel reality in which you are totally immersed that could have a lot of meaning, for example, in teaching, so for our students, the healthcare staff, for example, to manage different clinical scenarios and to acquire skills, especially in clinic and surgery. But the real, I think, great aspect of this is that you can repeat anytime you want a complex task, and you don't need volunteers needed, and you can perform it anytime because no consumable are needed, and also has a potential in the patient during a procedure, for example, for creating a relaxing environment to reduce anxiety and fear, but also in rehab. So the first thing in which could be used, a lot of universities, especially in US, adopt this method. You can teach your students in more interactive way, not just in the basics such as anatomic skills, anatomic knowledge and physiology, but also in acquiring skills for also ultrasound, for example. But could be really nice when you teach to your students how to manage a case in an emergency room, and not just to evaluate the symptoms of the patient, the type of procedure that you have to do, but also to join the environment and have a connection with the nurse, with the staff inside. And you can repeat this stuff anytime you want in order facilitate the curve and to reduce the error. I don't want to spoiler, this was a pneumothorax, so we go forward. But also, I've been trying this to face you today. Also, you can try to have your presentation in an environment in which you can also have questions from the audience and fear a little bit the fear of the presentation. But I think that the most useful thing of the virtual reality could be in surgery. This is a nice publication of 2017 made from the U.S. general surgery on U.S. general surgery residents about their independency. What they found is that after the postgraduate year, after the first postgraduate year, they feel unfamiliar with the most 5 done procedure. And we are talking about appendicectomy, for example. But also after the residency, they have a good performance on the most done procedure, but they still feel unfamiliar with procedure that are less frequent. And we don't want to face a condition like this. We should be trained before the procedure. So in the reason of that, there are still now a lot of procedure that you can do virtually in order to acquire skills and repeat the movement anytime you want to create more fast learning curve. But not just in standard cases. Now they're doing a lot of study for more complex procedure. And let me say, also, you can use it for teach a procedure from your perspective. This either that I did with these glasses that I'm wearing this moment. You just stop with your glasses and ask them to record the video. And this was a mock-up procedure, and the students can really appreciate what you do in that moment. As probably his most useful thing to let them know also the environment that you have and how to move during the procedure. Hey, Matt, I record the video, so I will show to my family tonight. Now it's recording. But also from the perspective of the patient is, I think, a great tool, for example, in reduce of anxiety. Think about your son. He has to undergo a procedure in which he's awake. You don't want to let your son see the operating room, but maybe it's better to see a video game or to play a video game. But also to in the intensity care unit, you have to ask your patient to do rehab and ask the patient to do a lot of time boring things that maybe with a play it's more easy to ask. So the reason of that, I started to try this technology also on my office. In this moment, I have a really little experience and enroll 10 patients in which I give them a virtual reality glasses. And during simple procedures such as sclerotherapy, laser therapy, carboxytherapy, in those patients that I already treated and they had the feeling of fear or anxiety for the needle, for example, or to have pain. I give them, after the procedure, a questionnaire to done at home and then give me back without name, just in order to avoid a little bias of my presence. And obviously, it's I have a lot of bias, a small number, different type of procedure, but what I'm seeing is really promising in terms of reduction, especially of anxiety of our patients. Instead, when we talk about augmented reality, it's a little bit different. It's something that can merge the real world with physical 3D virtual object. This is something that we can have an application in surgical intervention, clinical practice, rehab training, and more. Normally, when we face our vein procedure, for example, for sclerotherapy, sometimes we have one hand with the vein viewer and only one hand to do the procedure. Or if we perform an endovenous procedure for varicose veins, we're not looking at the patient most of the time. We're looking at the screen. But to avoid this and help you to do better your job, we already have infrared vein. You have both hands-free or polarized light display system that allow you to use both hands. And for the vein procedure, now every day is coming up new devices that allow you to have the screen on your glasses, and it has been tested for arterial procedure, especially for the puncture in US, in California, a navigation course system that merge previous CT of the patient with a specific glasses made by Microsoft, and you can see exactly where the artery is under the patient. But let's look at the future. We can have our patient and we can explain which is your medical condition, what I can do for you, and explain it in a better way. He can understand and give you a right informed consent. But you can also have a meeting, a workshop, not in person, or we can standardize clinical for example, such as in this case, you record what you see, and then you can watch it whatever you want to make more in a scientific way the evaluation of the possible improvement of the patient, but also to train your nurse or the staff that works with you. They can have the extraction for use. Have to take care about that. They have a system that tell them what to do. Now, I tried to involve also in this symposium. It was not that easy. There are a lot of startups that are using the augmented reality to merge a lot of information. For example, CT scan of the patient, and you can merge on the patient, for example, for a biopsy or for a procedure in spine surgery, for example, is mostly it's really frequent to have this condition. But in our field, also with the ultrasound, sometimes we should ask to someone that is in the operating room to do something on the screen or to help us with ultrasound. In this way, you can do and manage all the things alone. And then you can put the screen on the patient. So you are now looking at the patient and doing an ultrasound test. But one last thing, please don't sleep. I think it's the best thing I ever see. Now in the kit of, let me say, the name of the Philips, they put some glasses inside the emergency RCP kit and defibrillation. They give you the instruction. No, you cannot defibrillate this patient in this moment, so please do RCP. Put your hand in this place. No, not this. Yes, this one is correct. And try, push. No, this is not a good push. Too much push, you are going to break the bones of this patient. This is a good RCP. Please continue. In this moment, your glasses are calling 911 and ask them, please come. I'm going to share with you the position of the patient. So in this moment, you are still having a checking of the rhythm. Yes, you can use your defibrillator. Please keep clear, 3, 2, 1, defibrillation of the patient. Instead, the emergency is coming and you are not at the phone because you are taking care of the person behind you, and they perfectly know where are you in that moment, and they're going to find you without calling you. So in conclusion, this is a new universe that involves daily basis. It is possible to develop a sustainable and economical healthcare, but healthcare executive must be involved. So I think it's time to take a chance and see what the possibility that exists.